morning, everyone, and welcome to today's webinar presentation from Assessment to Intervention, a resource guide to applying NCAST-PCI scale assessments in home visiting practice. My name is Sarah Carsley, and I'm an Applied Public Health Science Specialist at Public Health Ontario, and I have the pleasure of co-moderating today's session. Before we begin with today's presentation, I would like to acknowledge that I am in Toronto, on the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. I also acknowledge that Toronto is covered by Treaty 13, signed with the Mississaugas of the Credit, and the Williams Treaties, signed with multiple Mississaugas and Chippewa bands. I'll now mention a few housekeeping items. To enhance the presentation experience, participant audio-video has been disabled. The chat pod has also been disabled to limit any distractions during the presentation. Please use the Q&A pod if you have questions during the session. A discussion and question period will follow the presentation. If at any point during the session you experience any technical issues, please email capacitybuilding@oahpp.ca. I would now like to introduce my co-moderator for today, Sonia Strom. Sonia is the PHN Prep Program Manager in the School of Nursing at McMaster University. From 2016 to 2018, she coordinated the Canadian Nurse Family Partnership Education, or CANE, pilot project. She holds a Master's in Science and Health Research Methodology from McMaster University and earned her doctoral candidacy in Family Relations and Human Development at the University of Guelph. Welcome, Sonia, and I'll pass it over to you.
Thank you, Sarah, and good morning, everyone. I'm thrilled to be here today co-moderating with you and representing the work that PHN Prep has done or has been doing in collaboration with an experienced team of NCAST-PCI instructors to support PHNs, supervisors, managers, and home visiting staff in their work with families. Today's webinar will introduce an NCAST resource guide developed in Ontario to support public health nurses in making decisions about next steps or interventions to offer to a family following completion of the Parent-Child Interaction, or PCI Scales. And it is now my honor and pleasure to introduce the speaker for today's presentation, Carrie Eldon. Carrie Eldon is an experienced public health nurse and an NCAST-PCI instructor working in the Population Health Division at Durham Region. She graduated from Ryerson Polytech University, now the Toronto Metropolitan University, and has 2 decades of pediatric and public health experience. She has provided public health nursing support to families enrolled in Healthy Babies, Healthy Children in the Durham region since 2004. And as an NCAST-PCI instructor for the last 7 years, she has extensive experience training and supporting nurses to use the NCAST-PCI scales in practice. So without further ado, I would like to pass things over to Carrie today to present her webinar.
Okay, there I go. I couldn't unmute myself. Hello, people, and welcome. I feel super honored and happy to have everybody here so I can talk about this resource. Okay, so the NCAST resource guide. So I feel I became an instructor, I want to say is in 2015. I really can't remember. And it was after that when I started instructing my staff at the Durham region that there was a lot of struggles with the nurses on how to implement the scales, how to talk to the families about the scales. And from there, I decided, well, maybe I can make a little bit of a resource guide to support my staff. I basically took the content from the PCI scales, the teaching and feeding manuals, both editions, to guide what I wanted to put in the resource guide. And I did provide it to my public health nurses and family visitors to help support them after a feeding or teaching scale, and along with PIPE activities. So I have 2 slides that I'm using right now. So let's go to this one. Okay, so why did I do this? Basically, I wanted to support my staff with the completion of the NCAST-PCI scales, understanding the importance behind why we are doing them, help my staff understand how to talk to our clients about strengths, how to provide the constructive feedback, what kind of interventions that we can use after the completion of an NCAST scale, a quick way to review each subscale. Sometimes when you're doing them, there's going to be one area that a client or family is going to score low in. So it's quick, easy access to understanding what that subscale is talking about. And then there's also a link to link specific PIPE activities to the different subscales of PCI scale. So before I did worked on this slide deck, I did ask for feedback from my staff to ask what do you find useful about the resource guide. So some of the information I got was after visits, they liked using the resource guide because it helps with their documentation, good suggestions for providing feedback, strengths and areas for growth in a positive and reassuring manner, provides areas for nurses to focus on, like areas of growth, PIPE activities, interventions, and basically after you do an NCAST scale, what to do next, how to guide your practice for the next home visit and then future NCAST scales. How did I develop this resource? So I reviewed both the NCAST manuals, and then when I did my initial training with Denise in Toronto in 2015, she had some really amazing PowerPoint presentations that I took some of the information from and embedded it throughout the guide, mostly around the strengths and areas for improvement. I did get a lot of feedback from my nurses before implementing this resource guide. And then the other reason why I was doing it was to assist my staff after the completion of a PCI scale. And then the main purpose was really to promote the healthy attachment through interactions. I find since becoming an instructor in the NCAST-PCI scales, really understanding the importance of like healthy attachment and how important that is in child development. So let's take a look into what the inside of the guide looks like. Okay, so what's inside? So each of the subscales are color coordinated, so it's really easy. So when you're in a home visit, you can quickly flip to the area that you're looking for. There's also a section for engagement cues, disengagement cues, and then the clustering of cues. The clustering of cues we just recently added. So when I implemented or when I launched this resource 2017, this part wasn't there. So after collaborating with Anya, we thought it would be best to add the clustering of cues. There's also a brief description of the concepts. And then there's also the linked PIPE activities for each of the subscales. I think that one's it. There we go. Next one. So the subscales. I'm not going to go through each of the subscales because they're basically laid out the same way. So each subscale, there'll be a brief explanation of what the subscale is assessing. So you have the subscale and then you'll have the directive, and it gives you a brief snapshot of what we're looking for in this subscale and why it's important. Then you're going to have the strengths part. So this is the part where you can provide the positive feedback or what you notice that was really good about the interaction. Sometimes it can be hard, especially working with higher risk families, to really find something positive to feedback to give to a family after. So they're kind of basic, but they're still really important. These strengths are really important to provide back. And then the next page, so see how it's color coordinated? You have the sensitivity to cues on the one side. Oh, I didn't flip. I flipped on my other one. So then you'll have it on the other side there. Then there's also the areas for growth. This is the part where there's the constructive feedback to provide to a caregiver specific to this subscale. There's also suggested interventions related to the subscale. So these interventions are specific to the sensitivity to cues subscale. And then there's also specific resources that can be implemented after the completion of a scale. There'll be another slide that I'll go through the intervention part as well. Oh, it's the next slide. Here we go. So the interventions. Each subscale has specific interventions. So in response to distress, responding appropriately to a distressed child also helps children learn emotional regulation, like an affectionate touch or soothing voice. can help calm a distressed child, which then leads to building those trusting relationships. The social emotional growth fostering, this one really captures eye contact. Eye contact provides early motivation for the social smile and language development. For the cognitive growth fostering, earliest form of infant communication, which occurs during feeding when infants establish a rhythm of sucking. During the pause of an infant sucking, caregivers will usually do something to get the infant to resume sucking. So jiggle, a stroke, vocalize. This is the first repeated experience infants have when establishing a pattern of behavior and responding to that behavior. Clarity of cues. Children and infants communicate through sounds, facial expressions, and gestures. Responsiveness to caregiver. It is through interactions and experiences with loved and trusted adults that children begin to make a sense of their world. They can learn to make things happen. So how many times are we in a home visit that a child will drop toys or a food? They'll look to see where it goes, and then they'll look at their caregiver to see the response from their caregiver. So there's also another piece. So yeah, you can bring up the PDF. So through, here it is. So NCAST on their website, they have these amazing keys to caregiving booklets. These are, you have to purchase them. We're lucky in Durham that we have purchased them. This is a new resource that's been launched that goes along with the keys to caregiving handouts. So look what I'm saying. So it kind of goes through the green, yellow, and red. So it talks about engagement cues, right? So the green light means I'm good to go. Yellow means I might need some support. Red means to stop. And so it helps. These are handouts that you can give to caregivers that help them learn about their infant cues, their child's cues, and how to respond. So the other part too on the interventions, when I was working with my manager, we didn't want to put too many resources or interventions on the guide, just because some things become obsolete. The great thing about this resource is that if your health department decides to take it on, you can adapt it to whatever resources and other interventions the nurses and the family visitors use. So other things that could be put in there would be like Healthy Baby, Healthy Brain. That's one of the resources I love to use with my families. There's also the Look-See checklists, and then the Best Star website. I think it was last week when we had the PCI instructor teleconference, or was it just, yeah, it was the teleconference. And I quickly reviewed this with the instructors, and I know other health units have adapted this resource and have implemented other handouts and references that they use within their health department. There's some health units that have really put in a lot more work, not necessarily work, but other resources that their nurses and family visitors can use. So that's really amazing to hear. So again, it's an adaptable resource that you guys can use to meet your needs within the health department and where you guys work. Okay, so the engagement cues. So when I worked on this page, I really just used the ones that were really easy to see. There's so many, like when we look at it within our manuals, there's so many different engagement cues and disengagement cues. These can also be used as talking points when providing feedback to caregivers. You can help caregivers understand when their child is needing their help. So going back to the Look What I'm Saying reference from, not reference, the parent handout from the NCAST-PCI scale website, that's a really good handout. I just released it to my staff, so I think it'll be a good resource to hand out to our caregivers. So it helps caregivers understand when their child is needing their help. Consider disengagement cues as the child expressing a need to alter or regulate the interaction or situation. They're attempting to communicate a need to the caregiver. So this is really good information when we're trying to help our caregivers and families understand this is what your child is saying. Recently updated to include the clustering of cues, which can be a bit confusing for parents to understand. Hunger cues are a mixture of subtle and or potent engaging and disengaging cues that happen prior to and at the beginning of a feeding. Satiation cues, a mixture of subtle and or potent engaging and disengaging cues at the end of a feeding. Listed are the most common clustering of cues that you would see. Okay, so now we're going to jump into the concepts. Okay, concepts. So these are so important to understand. It gives guidance to why we are assessing these areas. Knowing these concepts will help facilitate learning the items on each of the scales. 6 major concepts are embedded throughout both the scales: contingency, positioning, verbalness, sensitivity, affect, engagement, and disengagement. These concepts are useful in clinical practice, helps us to understand the intent of a specific behavior. In addition to looking at each subscale and their scores, you can also look for patterns of behaviors that occur across the 6 subscales. These areas can also be discussed with the caregiver and then reference those behaviors from the appropriate scale item. For instance, if you look at all the items that have to do with verbalness, positioning, affect, and identify both strengths and areas of growth, you can also reference the elements of the teaching and feeding scale. So if I feel I have another PDF, if you could bring that up for me. So this is a tool that I use when instructing my learners. It's specific to the feeding and the teaching scales. And what it does is it goes through each of the concepts and it pulls out all the scoring. So you have the feeding scale at the top and then the teaching scale at the bottom. So say you've completed a scale and there's really no areas that the caregiver has scored low in, but there's some feedback you want to, it might be a little bit harder to do it in the home. So this might be like at the next visit, you can provide this information, but if you go back and then you can specifically look at maybe they scored really low in the verbalness because they're scattered throughout all the 6 subscales on the feeding and teaching scale. So it all depends. This resource was all the instructors should have this so that they can hand it out to their staff if they find that this resource might be helpful if they're looking at specific areas. So there's the contingency, the effect, and you can really pull that out and then use this part of the resource guide to provide this specific feedback. Thanks, you can close this one down. So the elements of the teaching and feeding scale help locate the specific concepts specific for each scale. It was through these concepts that helped me guide how I wanted to create this resource guide. So the next slide here. This one here is for the PIPE and NCAST. I didn't create this. I feel it was Bernie who did this many, many years ago and had gone through and linked the specific PIPE activities to the specific subscales on each of the feeding and teaching scales. So for Durham, we have specific, we don't do all the PIPE activities, they have to be reviewed. So these are the ones that we're currently using. Again, this is how the resource can definitely be adapted to your own health unit, where maybe you guys have more PIPE activities that you're doing, that you can implement this or update the guide so that it's reflective on for your health unit. So the thing that's great about this is that after the completion of a PCI scale and say, okay, they're low in the sensitivity to cues, now you can communicate with your family visitor to say, hey, can you work on these PIPE activities? And then you can go back and then you can do the other interventions where you can do the infant cue cards, You can do the keys to caregiving handouts or whatever other resources that you're using within your health department. Do a couple of those, and then you complete a second PCI scale, and then you can see if there's any improvement in the areas that they scored low on. This is a really good resource. A lot of my staff find this page super helpful, again, for guiding their next visit and for guiding their interventions there. Okay, so when to use this resource? So again, I got feedback from my staff after the completion of a scale in the home. So again, sometimes we're struggling with what kind of positive feedback can we provide? I think the biggest area of concern is how to provide that constructive feedback in a positive and supportive manner, because we don't want to hurt our families' feelings and stuff like that. It's helpful with the documentation piece. So I know for mine, when I do my documentation, I'll say I reviewed it. I don't go into a whole bunch of the feedback I provided. I'll be really specific where I say I provided feedback on you did a great job on making eye contact. And then the next step would be to say, hey, maybe use more descriptive language when you're describing the task materials to your family. It's also a great tool for preparation for your next visit. So again, knowing that they scored low in a certain area, there's lots of resources embedded within resources and interventions embedded throughout the guide to help you with your next visit. It also builds your confidence. So one of the things Denise kind of grilled into our head was, hey, like if you don't use it, you lose it. So the more often you do the NCAST scales, the more confident you're going to become in completing them. I've done them so much and I've been an instructor for so long, sometimes it feels really natural and easy for me to do it. But I remember in the beginning, when we first got trained in 2012, I was like a deer in headlights. So I understand that it can be really nerve-wracking when you're talking about these skills with your families and what do they mean. I keep mine in my NCAST bag. That way it's easy for me to utilize and access. Okay, so where to access the NCAST resource guide? So I feel it's up on the Mac Health website now, so you can download it. I do want to say that it has been sent out to all the instructors for them to kind of send off to their management and to see how they want to adapt the resource. I can show you mine. So mine is the way we did it was a 5x5, 8x5 little handout. It's like a styrene kind of paper, so and we hold it on by a D-ring where it's super easy just to flip through. So super easy to access. And one slide left until Q&A. Friendly reminder. Okay, so and then it's easy. So if it gets dirty, you can definitely clean it and keep it sterile and stuff like that. So this one it's a new updated, and it has the updated number on October 2022. Okay, we have the last slide now, and it looks like we have lots of time for questions and answers. Maybe we won't have to use the next slide or a lot of time for question and answers, but here we go. And this is just a little shout out. So I'm not sure how many of you know, but I became a GG in October. So this is my little grandson and my daughter and my son-in-law. And then I can pass it back to Sonia, I think is what I'm supposed to do now.
Hi, Carrie. I just want to acknowledge and thank both Carrie and her team at Durham Region Health Department for their willingness to share this terrific resource with us. I also want to thank the incredible group of NCAST-PCI instructors throughout Ontario, particularly a working group who meet monthly and who helped contribute some ideas to help strengthen this resource. As Carrie mentioned, the clustering of cues piece was added after consultation with some of her colleagues. And this group also who encouraged Carrie to share it with you today. There have been a few questions about where the resource will be shared or posted. It has been shared with managers and supervisors in an invitation that went out from PHN Prep and attached to an email. It will also be posted in the PHN Prep community of practice on Mac Health. And as Carrie mentioned, it has also been distributed to the NCAST-PCI instructor community and posted on their community of practice. So Carrie, again, thank you so much for sharing this resource with us. I'm just going to open up the question and answer period now. I see that there are some questions. This one may be difficult for you to answer, but perhaps you could address the PIPE piece again. So someone has asked you to speak to the review and decision-making criteria for selecting those specific PIPE activities. I know that it wasn't necessarily yourself, as you mentioned, who selected that piece, but maybe you could talk to how people might go about doing something like this.
With Durham, we have a cleaning policy and how to keep things sterile. And I'm just going to make the assumption, I don't sit with the PIPE, so it was definitely, we have a PIPE working group, I just don't sit on it. I want to say it was regards to certain activities and how do we keep them clean. So I know on the toy list for the teaching skills, there's some that we remove because our health and policy or whoever it sits with didn't find that we could keep them clean. So like there's the zipper, there's the shoelace, and I think there's the puzzle. So those ones we don't use. I'm going to make the assumption that that's why Durham only used certain PIPE activities because of what items or materials that needed to be used, and we couldn't keep them clean, and that's why.
Okay, thank you, Carrie. Now I have another question on here. Not everyone might be familiar with what PIPE is. PIPE is used by some health units, but not necessarily by all. Can you give us an example of a PIPE activity?
Ooh. I think one, and I just did a joint home visit with one of my family visitors. I call it and I think it's the same way, it's your emotional bucket. So how do we do the self-care piece with our families that we work with? So one of the activities that the family visitors can do is help the client complete an emotional bucket of activities that they can do to support themselves, the mothers or fathers, in doing activities for themselves to fill their bucket up. And the reason why is like, okay, like you have like a cranky kid and, you know, your mother-in-law is visiting and, you know, you have to make this big dinner. We pull from our emotional bucket to manage those other stresses. But if we don't fill the bucket, we have nothing to pull from, and there's nothing there. We're running on empty. So that's kind of one of the, I'm not sure if I have any family visitors online with me who might be able to offer another one, but I think that's kind of like one. And the PIPE is partners in parenting everywhere or everyone.
Yeah, I think it may stand for Partners in Parenting Education.
Education, maybe.
Is that right?
Yeah, I'm so used to just calling it PIPE, right? Where, well, I think the longest term was just like NCAST used to be called something too, but now we just call it NCAST, right? Nursing Child Assessment Satellite Tool. That I remember that one, right? So.
Thanks, Carrie. Now, someone has asked if you are comfortable sharing your notes and slides from today. Of course, we will be posting, once the video for this webinar is available, it will be posted to the PHN Prep website. We can also share it in the community of practice. Along with that, may we have your permission to also post the slides as well as some of the other PDFs that you shared today?
Yeah, that one's fine. The only one I might be a bit hesitant would be the one from the NCAST website, the Look What I'm Saying. That one's copyright, so you have to purchase that one. So of the rest, absolutely. They just recently updated the Keys to Caregiving booklets and they're so amazing. They offer like little tips. They're more streamlined, easy to read. Again, I just yesterday just launched them to my group. So I love them. They're really amazing. And it's so nice to be able to give sometimes a hands-on thing to our families after the completion of an NCAST PCI scale. Like, I don't hand the entire booklets over. I'm really specific on which ones I hand out.
Thanks, Carrie.
Mhm.
All right, so I have a couple more questions for you. One person has asked, I am comfortable providing feedback on the first 4 subscales and find it more challenging providing constructive feedback to a caregiver in the area of clarity of cues and responsiveness to caregiver if a caregiver scores lower in those areas.
Okay.
So do you have any recommendations for those 2 areas specifically? So clarity of cues and responsiveness to caregiver.
So this one would be helping the caregiver understand the child's, how they're communicating, right? So one of the ones that I think after a while you do it enough that you really kind of recognize what's happening. So I did a visit earlier this week, and the child just turned 1, and so me and the family visitor come out, and the little girl is really close to the mom, and she's not really making eye contact with us, but she's constantly looking at her mom. So one of the things I help my mom understand, what she's doing is normal, right? We're strangers, but you've built such a really great bond and attachment with her. She's looking to you to make sure, hey, are these people safe? And from the reassurance from the mom, towards the end of the visit, she came up to us, she made eye contact, we played ball back and forth. So that would be one thing that I would help my moms or families understand. This is how your child communicates. We're strangers. The other thing I would say, this makes me happy to see, because sometimes we come out into homes and the child doesn't know us, but they crawl immediately into our laps. So that would be a red flag for me, where they don't even know me, but they're really looking for attention. So I'm not sure if that answers that one with the clarity of cues. I guess they go hand in hand, right? So this is understanding how the child communicates with their caregiver. So understanding engagement cues, understanding disengagement cues. So if that's one piece that I would help you to give to the caregiver, would be to understand, this is when they're needing your support, and this is when they're wanting to engage. I don't know if that helps.
Thanks, Carrie. I do have a comment that the version of the resource guide has been shared in a PDF that is, I'm going to guess, probably not necessarily editable. I think the idea is that the information is there for health units to choose to adapt, but but not necessarily editing the version that was shared by Durham region. Am I correct in kind of interpreting that?
And I remember mentioning it to my manager. I'm like, it doesn't look right. Like, there's like lines and weird things at the top. And from my understanding, it says we have a print department, or we call it card here, and that's their language, right? And so if you were to just to print it off the way it is, yeah, it's going to look that way. But if you go and you send it and have it printed accordingly, that's the information they need to make it look like this. I think.
Thanks, Carrie. So I guess if anyone is wanting to do any adaptations, though, they can probably put a request in. I'm happy to facilitate that through PHN Prep. You can always email us at phnprep@mcmaster.ca. I'll just add that into the webinar chat. And that request would go to Durham Region, as this actually has their name on the resource as it stands for now. So
sorry, Sonia, the other thing I think we could do too is, I know there's other health units who have adapted it. We could always connect, or you could always connect with them to find out how they managed it. But yeah, if you were to print it off as is, it would look kind of funny.
Yeah, well, it will look like a Durham Region resource, yeah, which is what it is, and definitely there to be shared with everyone. So I am just hearing some wonderful feedback as well. Some people are saying, I've been asking for something like this since we were first trained in the scales. one person is saying we could definitely use this resource in Toronto, so I'm happy to hear that. And they like how they're laminated or can be laminated and are portable. And you talked about bringing it in your NCAST bag, so that's excellent.
And you can clean them, right? So half the time, and you can bend them, they won't bend, like it's styrene or it's some kind of, or you can laminate them, it doesn't really matter, right? So, but they can be cleaned. They hold up really well. Like I'm pretty rough with some of my stuff, so they don't get scratched or anything. It's so much easier to use than having to flip through your manuals, right? Like that was one of the other things. It's just like it's so awkward to break out your manuals and flip through them, which can be a bit intimidating to our clients that we work with, where if I bring this out, it's color, it's pretty, it's light and fluffy, there's pictures in there, like they don't really know what it is, but it just makes it easier, and we're more confident that we know where to find the information in a quick moment after the completion of a scale.
Thanks, Carrie. So for those asking if it's in Mac Health, it will be posted there following the webinar today on the Mac Health Community of Practice, the PHN Prep, and the NCAST community, which is closed to those who are NCAST-PCI instructors. I have another question about a pipe activity. Lots of questions about. So under sensitivity of cues, what pipe activity would you do for floor time?
For floor time, oh my goodness. I think any of them could probably work. I don't know them. I have to be honest. I don't know which each one of these are. Again, they sit with the family visitors. But I would say any of the playtime, right, where you get on the floor and you play with your child, making the eye contact, following their lead. It sounds like the play ones would be pretty good. So baby's first teacher, playing is communicating. I want to say a lot of them would probably be floor time, with my understanding that that's what the pipe activities do. There's ones that are specific to the caregiver, but the sensitivity to cues, I'm trying to figure out which one would be. I'm not even sure what the emotional bucket one is, but I'm sorry, I can't really provide more information on that.
That's okay, Carrie, thank you. Someone has mentioned there is a floor time specific pipe activity.
Perfect.
So,
thank you, whoever did that.
Thank you. Not my area of expertise. All right, I'm just checking to see if there's any questions that I may have missed. Definitely a large interest in this being shared. So thank you so much again, Carrie.
Perfect. I find the question period is definitely easier than going through the slide deck. So.
Well, thank you so much. I know it's always a bit nerve-wracking to do something like this, and I appreciate that you were willing to come here today and share about this amazing resource. You can obviously tell there's an interest. So
I'm honored. I'm quite blessed that people want to use this, and that it's going to be something that's going to be useful for them. Like it's a huge honor, and huge shout out to everyone who helped me update it, get here, calm my nerves. Like my colleagues have been super supportive. So it's been a journey, but so happy to share it. And please, like, if there's specific questions, you can definitely reach out to me individually, and I can provide whatever support I can.
Thanks, Carrie. And hopefully we'll move for that 38% who are not as confident in terms of providing feedback, that hopefully getting their hands on this resource and will help shift them to a bit more confident, at least. I see someone has answered. Yeah, someone has answered it's pipe. Listen, number 5, floor time, for those who may be following along and are interested in this.
Oh, it's right there. It says floor time. Look at that.
Is there anything else that has come to your mind that you may wish to share as you're wrapping up today, Carrie?
No, like just to share that, use it, adapt it, make it your own kind of thing, add in more resources under the intervention part. Going back, the interventions, I want to say I think I just did a like everything when it came to the keys to caregiving. But like I mentioned earlier, because it's a resource that we use at Durham, I don't offer all the parenting handouts, right, for the keys to caregiving. It's just like I like to kind of save it because I know I'm going to be doing more. But some of the ones that I do like to give is infant cues. That's a huge one, and infant behaviors. Like those are ones I kind of favorited that I love to give out because it really helps the parents and caregivers understand their child's language. And ultimately, at the end of the day, we're just wanting to build that bond and attachment. And the bond and attachment happens through eye contact, affection, positioning, those kinds of things. And this is how I introduce it to my families and how important it is, in the sense that this helps build the trusting relationship. From the trusting relationship builds the self-esteem, the confidence, the resiliency. So this is why this stuff is so important. And again, the more that you use it, the more confident you'll be at giving the information, giving the feedback, noticing the strengths, and saying, hey, like you can do this a little bit better. Not necessarily a little bit better, but hey, if you did it this way, this is what you're going to help your child learn and understand. So that's just my piece. Like after being involved with NCAST and being an instructor for so long, just understanding the importance behind healthy attachment, the bond, the trust, and what it does. And we're just wanting to set our kids up for success.
Thanks so much, Carrie. Now I'll pass it over to Sarah to close our webinar for today.
Great, thank you. So as we wrap up today's webinar, I'd like to thank Carrie for presenting and Sonia for co-moderating with me. I'd also like to thank everyone who joined us today for PHO's webinar. And I see there's a lot of interest to do some further deep dives on these two important scales and the pipe scale. Also not my area, as you know. So I really want to mention the next webinar is on February 15th, the incredible power of gratitude. So registration will be open next week. So please keep your eye on your emails for those links to the webinar. You can expect to receive a brief and anonymous survey for today's session. Please try to complete this to help us improve our programming. And lastly, to access past presentations and view confirmed upcoming sessions, please visit the PHO website, head to Education and Events, and click on Presentations. Thank you and have a wonderful day.